to introduce Zach Green. Zach is with PTCB. I think many of you know him. He presents, I think there's only been 1 year he has not presented, and that was when another individual from PTCB came to present for us. He is, I always say this, he is the face of PTCB. So that's why I think all of you know him, even if you haven't been to a conference or a convention before. Very strong supporter of our association. And I will have him give you more detail about his background, but please help me welcome Zach to the podium.
Good morning. Thanks, everyone. Thanks for the warm welcome. Yeah, this is, so I've been at PTCB. This is my 12th year, and I think 9 times I've given a presentation, 9 or 10 times at this convention. So it's great to be back. And also awesome to see familiar faces and some new faces too. This is my disclosure. Of course, I'm just employed by PTCB. No, nothing else to disclose. So learning objectives. This is a pretty standard presentation. So you probably have seen some of these things before, but we tried to mix it up a little bit this year. So identifying advanced pharmacy technician roles and explaining their impact on pharmacy practice, recognize the purpose of credentials and advancing pharmacy technician practice, describe the regulatory landscape impacting pharmacy technicians' roles and responsibilities, and then discussing employers' applications of training and advanced credentials for supporting pharmacy technician careers. That last bullet is always the biggest topic. I know if you were at convention last year, we had a panel discussion in addition to a presentation about how employers are embracing growth in roles and responsibilities for pharmacy technicians. So I was excited to add this into the presentation. So more on that a little bit later. But of course, I do have to start off with a snapshot of the current practice of pharmacy. According to the Bureau of Labor Statistics, there are 463,900 pharmacy technicians doing this extremely vague definition of help pharmacists dispense prescription medication to customers or health professionals. I really wish that customers was changed to patients, but this is their definition. Some quick facts about the workforce. So out of those roughly 460-some thousand pharmacy technicians, in 2023, the median pay was $40,300 per year or $19.37 per hour. And then the 10-year job outlook, according to the BLS, it's a 7% growth, which is faster than the average, with about 47,400 openings across the US. This is a little bit dated because it is 2023, but you all work in pharmacy and you know that there is a shortage of pharmacy technicians and now even a shortage of pharmacists. So speaking to the points of entry to the profession, this is always very, very interesting. There is no standard across the United States to train pharmacy technicians or to enter the workforce as a pharmacy technician. Just by a show of hands, how many of you accidentally found yourselves in a career as pharmacy technicians? Yeah, large majority. There are a few who said, I want to be a pharmacy technician and became pharmacy technicians. I would love to see that number switch in the future so that we can teach middle school and high school kids about careers in pharmacy, including pharmacy technicians in that conversation. So right now, there are so many points of entry to the profession across all 50 states. There's on-the-job training, community-based on-the-job training, and health system-based on-the-job training. There's formal education. So these are anything from high school programs to like juniors and seniors learning in their allied health science track. They learn to become a pharmacy technician. There are accredited programs that are at community colleges, health system pharmacy, and even at community pharmacies across the country. And then there are also non-accredited programs. There's no requirement for programs to be accredited on a national standard. And some, like it calls out here in the second bullet under accredited programs, and the third bullet, the formal education can also fall under the category of employer training. So you might be an employee of a pharmacy or at a health system, and that health system has an accredited training program built in to it, but it is also considered on-the-job training. There are health systems around the country that offer that publicly, which is really interesting to get people not only on-the-job trained to fulfill a role as a pharmacy technician in their pharmacy, but also to attract people in their community and to, grow their local workforce to come into the pharmacy. They don't have to stay there, but, I think that's a really innovative way. Oftentimes these programs are free or really low cost for the community. And I think that's an excellent way for the health system and the community pharmacies to kind of give back to their community to get people involved in pharmacy. And then, of course, there's always Board of Pharmacy regulation. I shouldn't say always. There are a few states that don't have any kind of regulation, as I'll talk about on the next slide. But registration, licensure, and certification are oftentimes used interchangeably, and they absolutely are not all the same thing. Certification is an exam, and you earn that much like if you're a PTCB certified or state certified or certified through NHA. And that is oftentimes a pathway to registration or licensure, but a state board of pharmacy doesn't develop a certification exam. In most cases, there are a few states out there that do have their own certification exam that the state board of pharmacy has developed, but that is to serve as that pathway in that state to be registered or licensed in that state. And a couple differences between registration and licensure is registration, simply put, is being registered. You're put on a list, and that specific state has requirements for what gets you on that list. Oftentimes you have to be 18 or a certain age, fingerprints, background check, a fee, a fine, something like that in order to get on that list. And then you have to, in most cases, have a requirements to maintain yourself on that list. So an annual fee or every other year fee, earning CE is often included in that. And that is also very similar to licensure. But if we look at this compared to pharmacists, a pharmacist is licensed by the Board of Pharmacy, and it's vastly different than what it is for a pharmacy technician. And I think the biggest thing here is accountability, so that if something goes wrong, then there's accountability held by the Board of Pharmacy on that license for that professional. And that does happen for pharmacy technicians, but that's the key differentiator between registration and license. And this is really fun to look at from a national standpoint. 49 states and jurisdictions require registration or licensure. And this is actually now out of date as of May 30th, I think. This is now 50, but that does include one state. Notice it says states and jurisdictions, so that does include Washington, D.C. Washington, D.C. does require their technicians to be registered. But Hawaii just passed registration for pharmacy technicians. They famously said that they would be the last state to do it, and they are not. So that's great that there is now registration in that state. And why that's important is anybody can go to if a state doesn't register pharmacy technicians at all, that means anybody can go into a pharmacy, become a pharmacy technician. They can unethically steal drugs, get fired for that, and there's no repercussion. They can go down the street, get hired at another pharmacy, and there's no record of that if there's no like police or lawsuit or anything like that that would show up on a background check. In most cases that does happen, but the legal process is very slow. So a pharmacy technician could potentially do that for months before anything shows up on a background check, right? Which is dangerous. So that's why registration is important. And I'm glad to see that there are more states moving to that. There's been significant legislative and regulatory activity as seen here. And then the very last state to not register or license pharmacy technicians is unfortunately Delaware, which ironically is the first state. So I don't know, maybe they were just waiting, but they have been working on it for some time. New York and Pennsylvania also for a long time have not registered or licensed pharmacy technicians. New York is a strange state. They have registration for pharmacy technicians working in the health system, but not community pharmacy. Not sure how that happened or why that happened, but a lot of employers are taking it as a best practice to have their pharmacy technicians get certified at least, so that if registration does happen in their state, they can move into, register. They check that one box of the requirement to be registered in that state. Pennsylvania also, is anybody from Pennsylvania in the room? Okay, well, I'm not going to offend anybody at all, but I don't know what happened in Pennsylvania, but they had all this legislation that was passed. They were in the rulemaking process, and then there's this weird thing that happens in Pennsylvania where the public has a comment period, and they tried to squeeze in immunizations at the last minute, and that public comment period lasts a very long time. So now they maybe made a mistake by putting a date in there. That date has now since passed. So like, obviously the public comment is these rules aren't enforceable because that date is passed. So back to the drawing board, and hopefully by next year's legislative session, it'll go through and everything will be put into act to require pharmacy technicians to be trained and also certified and registered with the Board of Pharmacy, which I think is excellent. 18 states require national certification, and that could be PTCB or NHA certification, which I find surprising that fewer states that don't require national certification. And then this third block here is 21 states and jurisdictions with technician seats allocated on Board of Pharmacy. I call this out all the time, every single year, because this number changes so much. When I started at PTCB in 2013, I think it was like 6 or 7 people, 6 or 7 states or seats for pharmacy technicians. So this is huge. And I believe this is also out of date. So we might be at 22 now. Washington, DC just did it. And then this group of pharmacy technicians that serve on boards of pharmacy, they meet pretty regularly, and they've had their state pharmacy associations and all the national associations sign letters to send to all those states to that don't have pharmacy technicians serving on their board of pharmacy to explore that opportunity to have pharmacy technicians sitting on their board of pharmacy. It makes perfect sense, right? I mean, if boards of pharmacy are regulating the profession, then they should include pharmacy technicians in that conversation and in developing those regulations. So it's really exciting to see this happen. There are 23 states that allow technician product verification. I will say with technician product verification, also known as Tech Check Tech, which I'll talk a little bit about later, but oftentimes this is called out for health system pharmacy only. It does kind of block out community pharmacy, but that might be changing. That is changing slowly. So there are a number of states that do allow technician product verification, Tech Check Tech, in the community setting. And then this number is also out of date. Legislation happens, it happens fast in pharmacy now, except for Pennsylvania, sorry. But the 46 states and jurisdictions allow technicians to administer immunizations. And I want to say that this is beyond the PrEP Act. The PrEP Act does say that pharmacy technicians that are certified and trained in immunizations are allowed to administer COVID vaccines. And that's everywhere. That's a national thing. But these 46 or 47 states and jurisdictions have gone beyond. They said when the PrEP Act expires, pharmacy technicians will be allowed to administer vaccinations, and it goes beyond COVID in most cases. So I did want to talk about certification because those 18 states that have the requirement for certification doesn't really match the number of certified pharmacy technicians in the United States. So of those roughly that large number from the BLS earlier, there are about like 300,000 actively certified pharmacy technicians. So it shows that like best practice, at least if you're certified, you're making that additional step. But what does that mean? I did want to talk about a couple of these or a few of these areas, specifically speaking to checking the work of other technicians, Tech Check Tech or technician product verification, administering immunizations, and then point of care testing. Point of care testing is kind of new in some places, but exactly new in other places. Does anybody here do point of care testing in their role? Excellent. Is that new for you, or have you been doing it a while? Yeah, yeah. Same. 4 years? Okay, cool. There are a number of states that say we can, if pharmacy technicians are administering immunizations, then we might as well do like the testing for like point of care testing for that. So it just makes perfect sense to allow pharmacy technicians to do those things. Also, some state regulations specifically call out these other circles. So accepting call-ins, if there are certified pharmacy technicians on staff, they're able to do that. The ratio, the pharmacist to pharmacy technician ratio, can change based on how many certified pharmacy technicians are on staff. That happens in South Carolina. And then in New York, you have to be a certified pharmacy technician to compound. So, and then also transferring prescriptions. There are certain states that say certified pharmacy technicians are allowed to transfer prescriptions, but if they're just a registered or licensed pharmacy technician, then their responsibilities are limited and they can't transfer prescriptions. So it is specifically called out. So now that that's out of the way for the current practice, we can talk a little bit about advanced pharmacy technician roles. And this is fun because point of care testing, that we consider those advanced pharmacy technician roles, but I don't know if you consider yourselves advanced, considering that's your everyday role. And sometimes we're hired into what the profession considers advanced roles. So I have 2 slides here of examples. I won't read all of them to you, but you'll see some of these might be like, oh yeah, I do that every single day. And entry-level pharmacy technicians do that where I work. And that is fine, that's common. So this is not an exhaustive list of advanced pharmacy technician roles. It's just examples of how the profession views pharmacy technicians' advancement. One thing I did want to call out here is community health worker, because I have talked about immunization and technician product verification. Community health worker, is anybody here a community health worker? No, it's coming. Does anybody know what a community health worker is? So it's a wonderful opportunity for pharmacy, because we all know that pharmacy is the most accessible health professional. And what a community health worker does is goes out into the community and helps patients access many services. It could include, like 340B things, or access to payment assistance programs, things like that. But it is also how somebody gets food. Like, obviously, if you have to have food with a medication, a community health worker who is also a pharmacy technician have that knowledge of your prescription and your medical history. And if they know that you need assistance with food or even housing, there are pharmacy technicians in those roles that kind of, you can make an appointment at a community pharmacy and sit down with them, and this person will not only help you get all your medications and set an appointment with the pharmacist if it's needed, but also direct you to any kind of social services that might be needed. I think that's really interesting. And I love that pharmacy is falling into that category more and more each year, because we are the most accessible profession. Here's another slide of advanced role examples. I think a couple new ones on here. Well, actually not new, maybe to this group, but investigational drug specialist, medication access advocate, and then informatics technician. So let's talk a little bit about immunization. So I'll go over 2 examples on this slide. There were 2 studies done, one in Idaho, which was the first state to allow pharmacy technicians to administer vaccinations, and that was at Albertsons. They did a pilot. But as I mentioned, 46 states and jurisdictions now allow technicians beyond the PrEP Act to administer immunizations. And immunizations provide a first line of defense for patients at the most accessible healthcare location. Again, repeating that, most accessible healthcare location and profession. And then properly trained pharmacy technicians have the potential to increase the number of immunizations given and reduce the occurrence of vaccine preventable diseases. I was actually just having a conversation this morning with Mark about that. So the timeline for this, you'll see in a couple examples, a few slides ahead, that this timeline is really, really fast. 2017, that's when pharmacy technician training program was developed using pharmacist training. It was rewritten and redeveloped for pharmacy technicians. And the first immunization was administered by a pharmacy technician, was administered at an Albertsons in Idaho. And then unfortunately, 2020 happened. And then also, maybe fortunately, there's always, like, if we look at this from a positive spin and some silver lining, it caused our profession to fast forward to allow pharmacy technicians to administer immunizations. And then 2025, 46, maybe 47 now, that allow pharmacy technicians to administer immunizations. Here are the two studies I was alluding to when speaking to the immunization examples. So in Ohio, 65.9% of pharmacists administered COVID vaccinations, and then 76.2% of pharmacy technicians administered them. And the outcome was trained pharmacy technicians should be able to administer vaccines post-COVID-19. And this is a little bit old, and the link to the study is there on the slide, and I think you'll all have access to that if you want to read about it. But this, obviously, pharmacy, we like data. Data tells a story. It also does a great job at convincing boards of pharmacy that pharmacy technicians are capable to administer immunizations. And then in Idaho, there was a study for 25,000 immunizations were administered by pharmacy technicians, and there were 0 adverse events reported, which 0 out of 25,000 is a great number. 0 is great in out of any number, but and that was over a 5-year period. Now, speaking to technician product verification, this also has, I have 2 examples of 2 different states here, and you'll see how the timeline differs whenever I show that. So technician product verification, this is generally defined as checking the work of other pharmacy personnel or automated systems. This definition has changed over time, especially adding that or automated systems. So that's why the profession has kind of evolved to say technician product verification rather than check tech, because sometimes technicians are checking robots or prepackaged medicine. So that's where automated systems gets added into there. And then studies have demonstrated that specifically trained pharmacy technicians can perform this task as accurately as pharmacists, or more accurately, as seen here. So you can see the pathway from prescription filled product verification and then an audit. So this was done from a pilot in Iowa, and so they had to audit each of the, when they're doing the pilot, they did an audit of each of the verified products, either by a pharmacist or a technician. And the accuracy rate here, you can see pharmacist had 99.95%, and then the CPhT had 99.99% accuracy. So Iowa technician product verification, Iowa is kind of the leader in moving technician product verification for pharmacy technicians outside of health systems. They said, let's have the health system pharmacy come and train our community pharmacy and run this pilot. And what happened in community pharmacy is pharmacists spent time in their patient care increased by 133%, which is huge. The total number of services nearly doubled. So they increased MTM completion, immunizations, MedSync enrollment, and then they were able to also offer new services for MedSync programs, collaborative practice agreements, disease state-specific education, or targeted interventions. And then they even uncovered new reimbursement opportunities developed. And as I mentioned, there are 23 states that allow pharmacy technician product verification. Here is where the timeline drastically was slow. So this IPA is the Iowa Pharmacists Association. They introduced policy for Tech in 1994. Yes, a long time ago. PTC, for just a fun trivia fact, PTCB wasn't even around in 1994. PTC was developed in 1995. So this was even before that. Legislation didn't pass for institutional technician product verification or tech until 2007. That's a long time to have somebody say like, hey, we have a policy for technicians able to check other technicians, maybe automated systems as well, but it wasn't until 2007 that the legislation was passed. And then it took even more years after that for the first hospital to be approved to allow technician product verification, or tech check tech. And then in 2013, that timeline between 2011 and 2013 was kind of rapid comparatively, where a community-based pilot where 19 community pharmacies were approved. And then after 7 years, they finally adopted regulations for technician product verification. And a lot happened in pharmacy during that time. I mean, from 1994 to 2019, so much happened. Barcodes, like automation, PharmD happened, certification happened, registering of pharmacy technicians, the pharmacy technician even being called a professional happened. So nothing bad about this timeline. It just shows how drastically different this is compared to immunization. And the last example I'll include for this is advanced pharmacy technicians in point of care testing. And I did talk about this a little bit, but this is generally defined as clinical laboratory testing conducted close to the site of patient care where care or treatment is provided. And POCT is just something easier to say than point of care testing. So it provides rapid turnaround of test results with the potential to generate results quickly so that appropriate treatment can be implemented, leading to improved clinical or economic outcomes compared to laboratory testing. So instead of sending it off and waiting days, this can, in some cases, be returned same day or shortly after the testing. And of course, I have to cite this with another study because pharmacy does love data. And this was actually done in 2020. And we all know why. But this is done to evaluate advanced pharmacy technician roles in the provision of point of care testing. So CPhT supported point of care testing in the service delivery and limited to non-professional technical tasks. For example, like sample collection, quality assurance. And that word non-professional kind of jabs at me a little bit because it is a professional task. I think we could redefine that as a non-clinical decision-making task rather than non-professional, but that's the wording that was used. So 94% of those who received screening with CPhT involvement agreed or strongly agreed that the service was valuable. And this is of people receiving point of care testing. So 70% reported that they are likely to follow up with their primary care providers to discuss the results. And that's a pretty high number. And then 94% of patients were satisfied with the screening services provided by the CPhT. What I love about this is that means the people surveyed actually learned what a pharmacy technician was, because I don't know that the general public knows what we do as pharmacy technicians. I think they think whoever's behind the counter is a pharmacist, and that does us a disservice. So I like that even in this small sample, at least people had a conversation with somebody to say a certified pharmacy technician did your point of care testing, and these people were able to answer questions based on that. So there are some states, I do want to say, list them here. Oops, sorry. Sorry, give me just 1 second. I want to make sure I have the state list accurate and the notes are plentiful on this slide. Oops. Okay, so the states are Colorado here, Delaware, Idaho, Illinois, Kentucky, Minnesota, New Mexico, North Dakota, Ohio, Pennsylvania, and then Iowa has a standard of care model, which I don't know a ton about, but they do include point of care testing in that for pharmacy. So this is the fun part, advocacy and implementation of advanced roles. And this is also where I'll cite a few examples. There, it's just a little slow. So how do you do this if you don't have an advanced role in your pharmacy practice, or you've not heard of pharmacy technicians advancing into these advanced roles examples? Don't be your own limiting factor. I think that's the starting point, that just because your employer doesn't have a position that allows pharmacy technicians to do technician product verification doesn't mean you can't do it, right? Like, you can introduce this idea. Do some research. Pharmacy loves research. Know your state rules and regulations and utilize the resources that are available to you. Advocate and network. This is probably the most important one. You all are here networking, and I would say you're advocating for yourselves by doing so. There are people from all over the United States here. So no two states are alike. So that means the pharmacy practice settings you all work in are probably different. So in conversing with each other, networking with everybody, you can find out that maybe your practice site is doing something really innovative with pharmacy technicians, and you get an idea of like, I would really like to do that, or that will improve our workflow where I work. There's nothing wrong with bringing that idea back and at least introducing the idea to someone in charge. Maybe not even in charge, maybe somebody who's influential with somebody who's in charge. I will say, get involved with your state and national pharmacy organizations. Obviously, you're here with AAPT, and that's excellent because of that networking factor. And of course, earning CEs, that's important too. But you can be a member of your state pharmacy association. And a lot of states have either a community pharmacy association or a health system pharmacy association. And I encourage you to explore options there too. Oftentimes people who are attending those meetings and CE offerings do advocate for the profession, for pharmacy technicians to be professionals in the pharmacy profession. And then collaborate with similar sites across the state and collaborate with your state board of pharmacy. I will say that's really important because, to that first point under research, knowing your state rules and regulations, from my first few slides, those aren't concrete. Some may take a very long time to change, but some can move pretty rapidly. So knowing that you can go to your state board of pharmacy meetings is the first step. Attending those board of pharmacy meetings is the second step. It's really interesting to attend a board of pharmacy meeting if you're able to. And every agenda is public in every single state, so you can even see what they're talking about. And if something's interesting to you, I encourage you to either join virtually or ask your employer if you can attend. In most cases, your employer is going to say, what, you want to go to a board of pharmacy meeting and bring back information that's relevant to our pharmacy practice? Yes, please go. In most cases, maybe not all the time, but that option is there. And then plan and implement. Make your case, develop a plan, and then promote the benefits of advanced roles. There are many benefits to advanced roles. If you say to your employer, we will help with retention and recruitment if we have a robust career ladder or career lattice, their eyes will light up. It's like singing to them, because every pharmacy is worried about recruitment and retention, every single one. Well, maybe not every single one. I shouldn't go on record saying that, but maybe 97% of pharmacies are very focused on recruitment and retention. So there are, this simplifies it very much so, but internal advocacy, if you have an idea that you want to bring, we all know that pharmacist that's willing to champion you, us as pharmacy technicians. And oftentimes it does, unfortunately, take the voice of a pharmacist. Not always. We are in a place where pharmacy technicians are in leadership roles and they are trusted, and bringing ideas and proposals to directors of pharmacy are well received and listened to. So internal advocacy is extremely important, whether that's you're a pharmacy supervisor, or that pharmacist on staff that wants pharmacy technicians to advance. Make that proposal, even help with writing the policies and procedures. Like it's worth it. It's one less thing that they have to do. And oftentimes they're going to ask you to help with it anyway, since it was your idea, right? So then the second step of this would be training everybody, and then doing an evaluation on competency, and then recognizing if there are credentials that are required. So for example, I keep going to technician product verification. I was a hospital pharmacy technician. So technician product verification is something that I'm passionate about, because I didn't understand why a pharmacist needed to check off that I had a bag of saline. I can, like, it's not a prescription. I understand the importance of it, but I knew what saline was. I knew that it was a liter. Anyway, so building those, the competency evaluation, and then determining any type of credentials, and then implementing it in your pharmacy practice workflow. And then this is ongoing, and this is important. The quality assurance and process improvement, everything can be improved always in pharmacy. So making sure that you have quality assurance in place, and then take time to evaluate the processes. So I did talk about this quite a bit, but pharmacy technicians on board the pharmacy, you all know what boards of pharmacy do. And then, as I mentioned, this number is now out of date. There are 22 seats. And as a result of that letter that I mentioned earlier of this group of pharmacy technicians sending out to boards of pharmacy, there are now states that are saying, oh, maybe we need more pharmacy technician seats instead of just one, which they came up with this on their own. It wasn't this group of pharmacy technicians suggesting that, but these boards of pharmacy said, oh, we have 8 pharmacists and 1 pharmacy technician. Let's replace 2 of those pharmacists with pharmacy technicians. Like, let's make it a little more even, which I think is wonderful. They came up with that all on their own. And that's happening in one state. That's happening in Washington. And what happens whenever you go to other pharmacy meetings, people hear about this, and then they take it back to their state. So as a result of the most recent annual NABP, National Association of Boards of Pharmacy meeting that happened in May, we've now heard that 3 other states are also considering that, just from a simple conversation over coffee in an exhibit hall. That's how things happen. So pharmacy associations and advocacy. I do want to talk just a little bit about this before I conclude, but AAPT, obviously. I love seeing all the volunteer shirts. That's how things happen, no joke. So that's great. Volunteer with AAPT, keep your membership. If you're not a member, become a member and stay involved, keep networking. It's a great opportunity for pharmacy technicians. I wish when I was working as a pharmacy technician, I knew that AAPT was out there. But I think we're getting to a point now where we can start spreading the word a little bit better about everything that pharmacy technicians can be involved in, because I think we're more recognized in the profession. American Pharmacist Association, even though the name says American Pharmacist Association, pharmacy technicians can be members. And in fact, they just installed their first pharmacy technician on their board of trustees, which was a huge, huge deal. They had to rewrite their constitutional bylaws for their membership association of hundreds and hundreds of pharmacists and pharmacy technicians. But it's really exciting to see that now that pharmacy technician in that spot can vote on APHA's board, and that determines what APHA is lobbying for at Congress. So, for example, and APHA has a pretty strong voice when it comes to lobbying efforts. So that's just one small example, but what APHA says, could also influence pharmacy practice, and including pharmacy technician here at this high level is great. NABP, I did mention this, pharmacy technicians serving on their boards of pharmacy are able to then serve on district and national committees and task forces. And the first pharmacy technician from North Dakota she was the first pharmacy technician on a board of pharmacy, and now she was just elected in May to sit on the the head of one of the national task forces, which is a pretty big deal for her district. So that's great. This is the first pharmacy technician and it's 2025. So I think things are happening there. TPTS is the Pharmacy Technician Society. There are 6 pharmacy technicians on the board of directors, and then Pharmacy Technician Educators Council. PTEC has been around for a pretty long time, since the early 80s. And as of December 2022, is housed within PTCB. So PTEC serves as, it's like a division within PTCB. And 6 of the 8 leadership committee positions are currently filled by pharmacy technician educators. So the Educators Council, it's a membership association of those who teach and train pharmacy technicians, and it's made up of pharmacists and pharmacy technicians. So it's nice to see, because there is no national standard for pharmacy technician education and training, that at least there is a national group that meets relatively regularly to, we're working on developing standards for education. So all of that. More to come, but any questions over anything? Yes. Yes, thank you.
Roles have started to advance. What other roles do you think other than POC that?
That's a great question. A community health worker, I think, is a good, especially in the community setting. But there is community health worker profession doesn't want to become regulated. So pharmacy is very regulated, right? So you mix the two, and they don't necessarily. It's a difficult conversation to have. But I think that if you look at it from a practice, like your individual practice, like where can a pharmacy technician help? And then does the Board of Pharmacy allow us to do that, is where you have to start, I think. So where does a pharmacy technician fit in the workflow more than, to alleviate some of that pressure of needing more pharmacists? But I do want to add on to that with the American Association of Colleges of Pharmacy, AACP. They have a campaign called Pharmacy is Right for Me. I don't know if you've heard of Farm for Me or Pharmacy is Right for Me, but they do a concentrated effort in middle school and high school to advertise the career of a pharmacist. Until very recently, we've been working with them for a couple of years now to advertise the pharmacy as a profession and to draw more talent into the profession so that there are more pharmacists, but also more pharmacy technicians, because you can go into the profession of pharmacy and be a pharmacy technician and make that your career, make that your profession. So I don't know about specific examples of what you could do, but I think like looking at the workflow and finding out where it is, and then long-term with more people interested in pharmacy, that hopefully won't be a pressure point. Yeah. So what the list is, so it was, Nebraska was not on the list of states that I listed for POCT, point of care testing. This is where, I don't know if Nebraska actually does have point of care testing for pharmacy technicians. They may, but it's not in the regulations. Like, it doesn't specifically say that pharmacy technicians are doing this, or this is what the pharmacy technician responsibility is in point of care testing. So if it does exist, it's not specifically called out in rules and regulations. Or if it is called out, please let me know. Yeah. So the question was, what do pharmacy technicians do on boards of pharmacy? I'll actually start with that. It depends. Each state is different, unfortunately, how somebody gets appointed to a board of pharmacy, but oftentimes it's a governor appointment. So somebody has to be appointed by the governor in that state, and then it is a volunteer position, and it's, there's a term limit on it, but they meet regularly and they go over conduct cases. And that's like the simplest example that I could provide of what a board of pharmacy does. But they also talk about the profession, and every state has a long list in lots of fancy legal terminology of what a pharmacist does, the scope of practice of pharmacy, and what a pharmacy technician does. So they revisit that all the time based on what's happening in the actual profession. So, and technicians being involved in that conversation is really valuable, because for a long time, only pharmacists were involved in that. So if something does change, then pharmacy technicians can be involved in that conversation. Yeah, all of the above. Yep. Yeah, they do. And it really depends on the topic too, right? Like, I'll use immunizations as an example because that moved really fast through all the states because it was a national statement at first that said certified and trained pharmacy technicians can administer COVID vaccines. All the state boards looked at that and they said, okay, well, this study has actually been going on in Idaho because they've been doing it for a little while. So let's look at that data. And oh, wow, pharmacy technicians, 0 adverse effects. Then, they look at that data, they discuss it, and then they vote on it. And then depending on the state, it might have to go out for public comment like it does in Pennsylvania. And most states actually have a public comment period. It's just not quite as long as Pennsylvania's. So, and then they evaluate the survey from the public and also the profession to implement any kind of changes.